As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community.
All right, welcome to Your Health with Terrebonne General Medical Center. I'm Martin Falls, and let's introduce our guest for tonight. There on the left, Dr. Erin Pennison, OBGYN at Terrebonne General Medical Center. Welcome aboard.
Hi, thanks for having me.
All right, anytime. And Laura Poole, you've seen her face many times on HTV, Director of Women's Services at Terrebonne General Medical Center. Welcome back, Laura.
Thanks, I appreciate it.
All right, Dr. Pennison, I guess we're going to start with you. We've heard about the elusive 40s. What exactly does that mean?
Well, it's that time between 30 when a lot of women notice certain changes in their life and feel like it's a milestone, and in between 50 when everyone knows 50 is midlife. So we try to address the elusive 40s just to prepare women for what could happen in their lives during that time and maybe prevent any like serious complications or diseases that could creep up later on.
Okay. Now, the changes that occur in the body during the 40s, what could you tell the audience? What are they?
Usually it's mostly due to hormone changes, but the main complaint we get is weight gain. And so women need to know that their bodies change regardless of what they do or don't do. And if they can build muscle, they may minimize weight gain because you just tend to gain fat, lose muscle, your metabolism slows, and then the weight comes on and on. And weight gain, will increase your risk for other things in life like diabetes, heart disease, and other things that you want to prevent.
It happens in men too.
Yeah,
Men
really.
get big at that age too. Had to throw that in anyway. Menopause at 40, how does it affect people at 40?
It's pretty unlikely to go through menopause in your 40s, but you may have some fluctuations in hormones, and that's what we call perimenopause. And it's very unlikely to be in menopause at 40, but more like 49 to 50 or even a little bit older than that. But you will notice some hormone changes that can lead to hot flashes, maybe changes in your menstrual cycle and mood swings, sleepless nights, those things.
Okay. Laura, let's turn to you. The areas that the viewing audience should focus, the women should focus on during their 40s. What areas should they focus on?
Well, there's four main areas that really, it's a good idea to go ahead and focus on. Looking at your diet and basically making sure that, I know in our 20s and 30s we tend to be able to get away with a lot more than once we hit our 40s. You do put on weight a lot faster, so you have to be conscious about food choices and making sure it's more balanced. Often we refer to kind of like the carbohydrate hangover. If you eat a lot of one thing, it's just basically gonna leave that kind of residual feeling for you, as opposed to, making sure it's a balanced diet, making sure that you exercise, making sure that you take care of yourself. Women have a tendency when we get into our 40s, we have so many responsibilities, and it's just really important to focus on yourself and making sure that not only is everybody else okay, but that you're okay also. And then knowing what kind of screenings are recommended by your physician and making sure that you comply with those recommendations.
All right, very good. We're going to take a short break here from Terrebonne General Medical Center. When we come back, we'll have more discussion. Don't go away.
My husband and I have known each other since high school, and Bobby and I are very close. When I started losing my hair during my cancer treatment, he volunteered to shave his head too. My name is Sherry Starkey, and in 2007, I was treated for breast cancer at Mary Bird Perkins. 2 different doctors recommended Mary Bird Perkins, and everybody there was fantastic. And I know being close to home and family really helped a lot too. I'm still here, and Mary Bird Perkins had a lot to do with that.
Mary Bird Perkins Cancer Center at TGMC.
With the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
All right, welcome back. Let's reintroduce our guest if we can. There you see on the left, Dr. Erin Pennison, OBGYN at Terrebonne General Medical Center, and Laura Poole, Director of Women's Services at TGMC. Laura, for people watching tonight, adjusting the exercise routine, how can they do that?
Well, generally when we're in our 20s and 30s or even younger, basically if you walk or you run, you basically are able to, decrease some weight gain, firm up certain parts of your body. But after you're 40, it becomes even more important to make sure that you not only do cardiovascular, but you also add weight training to your workout. It doesn't have to be all that long, 20, 30 minutes, 3 times a week, but it gets important, even more important to make that commitment. Oftentimes, with people around us, they complain that, I walk, 6 miles a day, or I run 3 miles, 3 times a week, but my weight doesn't move. And the problem comes in that the weight training has to be added, and you have to start to be able to build, muscle, because you actually start losing muscle and it becomes more of a fat, as opposed to what we've traditionally done. So it's definitely a frustrating situation, and I could see where, most women would get frustrated with the situation and feel like they not necessarily wanting to keep up that type of routine, and it is very important because it will have added benefits over the long term. It'll strengthen your body, and that way, if you try to do activities that normally you don't do, you would have somewhat of a tolerance for it as opposed to what you would normally do. And also, it decreased risk to possibly developing osteoporosis later on. So it does have a decreased risk for blood clots, cardiovascular disease. So it has all these added benefits. And again, it's taking the time and making sure that you focus on yourself.
All right, very good. So Dr. Pennison, the big question, what to eat or what not to eat?
Right.
Can you elaborate?
Well, there's all kinds of fad diets, and we really try to encourage our patients not to go to a fad or an extreme diet, but you want to limit the amount of carbohydrates in your diet, sugars and fats, and increase your lean meats, proteins, and definitely vegetables and fruits. We always check women for their calcium intake and how much calcium they have in their diet. And if it doesn't seem like it's enough, then there are supplements that are available. Calcium is important to keep the bone strong and prevent risk for osteoporosis later on. And some women do get pregnant in their 40s, and so we always encourage them to take folic acid supplements, and that's included in most multivitamins that are available for women at that age.
Okay. Laura, specific screenings that women, when do they begin, and can you take us through that?
Basically, it's very important to make sure that you maintain your relationship with your physician. Making sure that, I think sometimes people are concerned that it's going to add another level of visits or, take time. But basically, if you've already committed to doing your routine checkups, a lot of this can be basically addressed at that time, and making sure that your needs are met and that you have the opportunity to talk with your physician and make sure that if you have any questions. But there's so much technology available now, and you really should avoid, being intimidated by taking advantage of the opportunities, because as Dr. Pennison mentioned, this is a good time to be proactive rather than reactive to health screening information. It basically can keep you on a very good path as far as your well-being, as long as you stay on top of it, make sure that you make that commitment. And when you go for your OBGYN physician checkup, usually they'll suggest the opportunity to do an executive profile, which includes a cholesterol screening, testing for thyroid, and also looking at if there's any indication of the development of diabetes.
And Dr. Pennison, I'm sorry, what else can they do during their 40s to care for themselves?
Well, to make sure just take time for themselves and to enjoy life in their 40s, make sure that no diseases do develop. And the main thing is to be educated about the changes that are going to happen. So you can make lifestyle adjustments early on so you don't have to start taking medications. And just be aware of the changes so you're not concerned or letting something go that needs to be addressed, We try to assess risk when they come in, doing blood pressures, routine evaluations. We try to screen for risks, and then we try to educate on what to do with with the results and how to prevent disease from happening.
All right, I appreciate both of y'all being here tonight, and thank you so much for joining us.
Thank you.
All right, we're gonna take a break. When we come back, we're gonna be in the Canada's kitchen. We'll see what Chef George has in store for us tonight, so don't go away.